Good morning, everyone. Thank you for joining us for this early bird webinar in partnership with Merck Sharp and Dumb. My name is Dwayne Schultes. I'm the Managing Director of Vital Transformation, and I'll be moderating this webinar today. We'll be discussing today the situation with Ukrainian immigrants and migrants who are being forced to move into Eastern Europe to deal with their treatment of cancer and the hardships and difficulties this is causing for many of the CEE countries. Now, before we get started, if you're having issues with your bandwidth or connectivity, we have provided several dozen phone numbers for you. You can dial in and switch between the computer and the telephone. Please feel free to do so. As well, we will be taking your questions. If you have any questions you'd like to submit, please use the Q&A bar in the bottom of your menu. You push that, this box will pop up, and we can then take your questions, and we're happy to take them. We've only got a half hour, so please, if there's something you'd like to ask, try to get them in early. And again, thank you very much for your participation. Ukrainian cancer patients are fighting two battles right now, the war with Russia and life-threatening disease. Continuity of care is vital for vulnerable patients suffering from chronic conditions such as cancer. However, the supply of life-saving medicines and the security of healthcare facilities in neighboring countries are few of the many critical challenges they now face. In response, international cancer organizations and patient groups are coordinating their responses. One example is the new special network on the impact of the war in Ukraine on cancer, which has been created by the European Cancer Organization, ECHO, and the American Society of Clinical Oncology, ASCO. This initiative supports oncology clinicians and their cancer patients in the area, but much more still is needed to be done. What are the key challenges that cancer patients face in these times of crisis? How has the international cancer care community been supporting those affected in this terrible situation? And what needs to be done now to ensure that we are providing uninterrupted care in the short and medium term? And I'm very pleased to be joined by two exceptional speakers today. First, I'd like to introduce Dr. Bettina Rill, the founder of the Melanoma Patient Network Europe, MPNE. Good morning, Bettina. How are you?
Good morning. Pleasure to be here, Dwayne.
Pleasure to see you from a hotel in Switzerland. It's lovely.
That's correct.
Thank you for joining us. And as well, I'm very pleased to be joined by Dr. Marius Gianta, who is the president and co-founder of the Center for Innovation in Medicine from Romania. Good morning, Marius. How are you, sir?
Good morning. Good morning. Good to see you. I'm happy to join you so early in the morning.
It is, and thank you for joining us from Eastern Europe. We're going to have obviously many questions about that, Marius, so thank you as well. Bettina, I'd like to start with you. Cancer treatment in Central and Eastern Europe has already been under enormous pressure before what's happened in the war between Ukraine and Russia. Obviously, there have been huge impacts in GDP. We're reading that in Eastern Europe in particular, we're going to be seeing declines of 30% in gross domestic product. And this is caused in the combination of the situation that was already bad because of COVID-19. Where are the patients now? How are we doing? And what is happening to cancer patients that you're hearing through your network?
So, well, you already stated the obvious. So we're already starting, we have already not a great starting point. And as soon as the war broke out and first people started moving, we were contacted by patients on the run. And we've had contacts in Ukraine before, so we have colleagues there. And of course, you're worried about the people and you start reaching out. And then you realize, it's like, well, they were like, what do we do? And I think everyone was surprised. I think the patient organizations, because they had personal connections and knew the people personally, just got into action maybe faster than others who didn't have that personal connection. And I think we have all seen the images that the what we call the first, while internally we call them the first line of help. So the countries bordering Ukraine have been amazing in receiving the refugees coming and providing shelter and accommodation and food and whatever is needed. And they were ready very, very fast. And among them were cancer patients. So you're looking at a moving problem if you want. And our colleagues in these countries have been trying to help getting access to healthcare facilities, like for themselves, for these patients. But if you're already starting with a waiting line, a queue, you just add to it. And that doesn't help anyone. And then, of course, you have a situation where you have patients who cannot wait And that is then when it's crunch time and when it really becomes urgent that we have effective solutions. So, you know, if you can wait, if you have a little bit of spare, a few weeks can already make a big difference. But what we have seen, and that is very much dependent on the disease, of course, how fit a patient is, whether a patient can still move or can't move. I think we just have been trying to find solutions to that. And I think this is something that, well, it's the biggest displacement since World War II. So it's not a situation we have seen at that scale across Europe. And I would say we're learning with every single case because everything has taught us something new. There is very little repetition in there. So we haven't seen one pattern, and this will help on how to get this done. So it is a lot of finding solutions for single individuals. And I'm sure Marius has a better insight into the Romanian situation. But this is kind of how we started and how we kind of, you see the need and then you begin to think how you're going to solve that. And then on the other side, I think it took a long time for some countries to realize that there was the problem coming, especially on the Western side, because I think you feel so far away. And a million, you know, what is a million? It just like, it feels, you know, or you could say 100,000, a million, you don't feel a million, you don't feel 3 million until you see them really. And then you see how large the problem is. So I maybe stop there, but just like, you know, as we kind of, I think we all kind of were surprised by this. We have no prior experience. It's out of our comfort zone. The pressure is there. We know people moving, and it was more like we have to do something. And I think this is how we started.
Yeah, and cynically, if we, you know, remember what Joseph Stalin said, a million is merely a statistic, unfortunately. And that's the problem. When the numbers get this big, it's often easier to ignore them. It's kind of perplexing, but it's true. Marius, you're there. You're on the ground very close. You're on the front lines of this mess. Picking up on what Bettina was just saying, how are things going now? What is the treatment situation like? Are patients being treated, and what are the impacts this is having on the system in Romania?
Yes, let's put first some numbers in order to understand the impact. We currently discuss about more than 3 million migrants. More than 95% are actually in the neighboring countries, in Moldova and Romania, as well in Hungary, Slovakia, and most of them in Poland. But as well are more than 8 million people that are internally displaced in Ukraine. So this is another big issue, and is very, very complicated, I think. On another side, I think that the war and the war in Ukraine, which is a crisis in the EU, actually came in a moment where the health systems in the Central Eastern Europe trying to go out from the pandemic pressure. So the fifth wave doesn't end yet, but in Romania and in the region. And we know how difficult it was for the cancer patient to access cancer care. And we have some data from our hospital showing that compared to the reality before the pandemic, in the 2 years of pandemic, actually up to 20% of the patients actually have access to care. So this is the situation, let's say the local environment, the local situation before the war. Now with the migrants, of course, the European Commission activated the temporary protection mechanism, who first of all is temporary, and then was up to every member state to decide how to implement it. And funny or not, in Romania at least, we should go back to 1961, so 61 years, to identify like an understanding between the Romania and Soviet Union, not Ukraine, of course.
Right.
And based on this agreement, actually currently the Ukrainian migrants in Romania can seek care in the Romanian healthcare sector, because otherwise we don't have other mechanism in place at the local level, at the national level, to deal with the need of the migrants. I mentioned that I actually pointed the temporary on the temporary protection mechanism, because we expect for the war to continue, but of course for the crisis to continue even more. So this temporary should somehow become permanent, but I think we can discuss this later on.
Yeah, now practically, so given that there's this agreement that's in place and people are expecting treatment, is that happening? Is that going on now? I mean, Bettina, you're shaking your head. Marius, I'll come back to you, Bettina. But Marius, I mean, what's the situation? I mean, is care actually being delivered?
Yes, based on based on our insights and as well confirmed by the authorities, the Ukrainian citizens that seek care not just for cancer but for any diseases, actually they have access. The problem was at the beginning that they didn't know that they can seek access, to go to our hospitals. But we cannot compare Romania with Poland because the number of migrants here is quite low compared with the country, with the entire population and so on. It's more critical in Moldova, where the number of migrants per population is the highest in Europe. And we know that the health system in Moldova have some big issues to be solved. And for them, indeed, it's a problem. It's in terms of access to current care, but as well to new technologies and innovation. I'm not saying that it's better in Romania, because we just seen the weight indicator showing that is a patient with a chronic disease in Romania should wait up to 900 days to access the medication. The EU average is around 500 days. With the best example in Germany around 100 days. So there are a lot of challenges at the local level, as well for Ukraine, for neighboring countries, for the health systems, and in general for the society. And I'm afraid that we'll not be able to cope with this crisis, with these health threats on the long term without some very concrete interventions.
Now, Bettina, you were sort of shaking your head. You must know the situation as well with your patient groups. There's the question of treatment in general, like getting access, and then there's also treatment delay. What's going on from your perspective, from your network?
So, well, very early on, the official communication from all the states was, Ukrainians get the same care as everyone. And that sounds, of course, very good and makes a very good press release. But if you then look into the details, and I tried to find it now, but I've been talking to my Central Eastern colleagues from Latvia, from Poland, from North Macedonia, from Romania, and they see issues in Hungary as well. So there are always issues in three different areas that we see. So one is access to drugs. That has been a long-standing topic, as Marius just said, with differences in melanoma. We've had our fair share of that. There is access to specialists, because these countries usually have a too low number of oncologists per the number of patients to start with. And then there are diagnostics, which for cancer follow-up, just like, for example, early detection of brain mets is another issue. And then you have, for example, radiotherapy units, which are important for treatment in cancer as well. So you have, and in my opinion, one has to look at the issues separately for each of these four categories, because the solutions will be different for these four categories. And you have to adjust them per country, because countries are very different. They differ in their infrastructure, they differ in what is available and how the healthcare system is organized, and how much the patient, for example, has to take care of themselves. So I know that my Romanian colleagues right now are spending insane amounts of time trying to organize to get, for example, an imaging, a diagnostic appointment, which patients have to organize themselves. Romanian patients know that, but a Ukrainian patient arriving there has no idea how to go about it. So they're thinking about now writing guides, kind of, how to navigate the system, because that is something volunteers do for arriving patients. In other countries, the drugs are always an issue, because often there is something like a limited budget that is, earmarked for expensive drugs. Unfortunately, melanoma is a cancer where the old stuff doesn't work, so we're reliant on these novel, expensive therapies, and so these earmarked budgets. That's actually something that's rather easy to solve in a way, because you can, you pay for it, you can have a transfer at an EU level. What is much harder to clone is oncologists. I mean, you can't just say, we need more oncologists, we need more hospitals. You can't just snap your fingers. Even money is something that needs some more, rethinking, restructuring, maybe help from across. For example, our Polish colleagues say at least many of them understand Ukrainian. So they have many, so the communication is a bit easier. So they often kind of manage, or they have someone already living there. Poland has already accepted, I think they already had 2 million Ukrainians who had, moved there before. So they have already capacity on the ground to help, like also with the language issue, which other countries do not have. And that still doesn't help you then with the radiotherapy, for example. So I think we really have to be strategic, just see what is missing and how to address it. And ideally at EU level, because I mean, every country fixing it for themselves, this is never going to work. So it's unfortunately, making problems we've had in the past worse. And it shows the cracks in our systems, and they were already weak there. And to make matters worse, what we have seen is one of the first things that was reported was that vaccination rates, we know in Central and Eastern Europe, were already lower than in Western Europe. They even lower in Ukraine. So we had people arriving into a COVID area. We were just trying to get out of COVID. And the next, now you have people moving, which in terms of infectious diseases is always a risk. It's not just COVID. It's also, we see HIV coming. We have multi-resistant TBC, hepatitis C. So, and my colleague in Poland is a pediatrician. She says that their children there often have a lacking base immunization, for example, polio. So it goes to that level. So, and then cancer seems in a way like, shouldn't be saying that, but it seems like a luxury to discuss. It's kind of, we are worried about cancer, but if at the same time an infectious disease is undermining everything, so we have to get our priorities right. We have to think about both at the same time. So it's this kind of mix that makes it so difficult.
It's a similar cocktail to what you had in World War I with the Spanish influenza. It's sort of that situation now where you're moving millions of people during a pandemic. It's not good, to say the least. We've had a couple comments and more comments and questions. And again, thank you very much, people. If you want, all of our listeners, please go to the Q&A button. And someone here is making a very good point. They're anonymous. We appreciate the comment. They're discussing, and it's obvious they're in the know, that there's enormous disruption with PET and CT scans, just availability of scanning. And there were 3, I'm going to summarize, it's quite a long comment, but there were 3 centers in Ukraine, and now a lot of that is being pivoted off to Poland. And this is putting enormous pressure on, already scanners and CTs are there's a huge lack of availability. Everything's been centralized and optimized. And so they were already under pressure for scanning ability. And now this is becoming a real problem in Poland, what this person has said. Thank you very much for your comment. Marius, this gets back to a lot of the discussions you and I have had previously, and Bettina as well, about the cross-border healthcare directive and how this is really not necessarily working. Bettina sort of brought up the point, the call to action here is, someone needs to step in, probably the EU. What do we need to do here to fix this? I mean, if this is sort of exacerbating already existing problems, what do we need to do to fix this as far as who should be opening up the wallet? Where does the responsibility lie? Is this an EU problem? Is this a WHO problem? Where does this go?
Yes, I will start by saying that EU should act. And I think the cross-border directive is just one of the tools that can be used in this context. We have at the EU level, especially in the context of the Beating Cancer Plan and Cancer Mission, we already defined this framework of inequalities with a very important part, the West-East divide. And we are now actually in this equation, with the Eastern countries, neighboring countries of Ukraine, that actually should overnight deal with a big number of patients from Ukraine, and to try to solve them with the existing resources. And having these inequalities, frame at the EU level, I think it makes sense to push, maybe to suggest whatever to the European Commission somehow to prioritize the neighboring countries, the Central Eastern Europe countries, in the ongoing EU-funded programs like EU for Health, like Horizon Europe, like Next Generation EU, like Digital Europe, and this something that can be easily done just by being aware of these inequalities that has the chance to increase even more. And Bettina mentioned the threat of the communicable diseases with SARS-CoV-2 and COVID in front of this. And yes, I think this is a very easy way to move forward, to look on what we have in the work programs for this year, for next year, for 2024 is not available yet, but we should start thinking on how to prioritize the investment, the capacity building in the neighboring countries in this current framework of inequalities. Because I think if we'll not act now in this direction, when will come the midterm evaluation in 2024, guess what? We will see that the inequalities will be even bigger between the East and West. And we'll try to understand why. And maybe in 2024, some of us will wait that currently we have 3 million people that overnight came in our countries. And as well, in 1 minute, I think it's very important to have a program for migrants. And this is, I think, the opportunity for the cross-border directive. Because most of the people, and I've discussed with some of them, they go from the eastern part of Ukraine to western part. Maybe they go to neighboring countries, waiting for the war to over and then to come back home. But in the meantime, they might need medical care. But what about their medical data? And I think if we will rely on the health at the national level health system, to implement now electronic health records for migrants, I think we are over optimistic. So I think the EU somehow should involve in this, and I think this is an opportunity to dealing with the communicable diseases with SARS-CoV-2. Bettina mentioned as well polio. There are other diseases, infectious diseases that we know the rate in Ukraine, the incidence rate is higher, the vaccination rate is lower than we have in the region. This is a threat and should be addressed in a structured way. And I see here a role for the European Commission, for WHO Europe and ECDC to think on a program for migrants. And maybe to start with the communicable diseases, and then to move to non-communicable diseases if the patients need. But the idea is to put this in the frame of inequalities and the use of cross-border directive and especially the digital tools.
Yeah, Bettina, you want to comment?
Yeah.
So I think the first thing we have to just be a bit realistic. There is the European Commission sitting on a bag of gold they're going to distribute. The European Union, that's us. What the European Commission does is they table a proposition to the member states who have to agree to it and have to put the money on the table. So it's not the European Commission will go around decide on behalf of all of us. It is something that we as member states together have to get our head around and decide we're going to do it. And that has to be supported by the national populations as well, because they are the voters. So we have to get out of this idea that the European Commission is this type of Uber government. They're not. This is not how Europe is structured. So it has to be a discussion between the member states, and it has to be clear. And we also can't be naive. The money will never just go to Eastern Europe, because it has to come from somewhere and it has to be supported by those populations there. And if we don't find a deal where everyone sees this is the best for all of us, we all win if we do this, it will not fly. We can talk and complain till the sheep come home, it will never work. So we need a vision for what we want to be as Europe. And I agree with Marius that if there was a better time, then the time is now. Because I think there is an understanding what is at stake and what we stand for and what type of future we want to see for our place and what we do not want to see. Migrants are moving across borders. With that come certain challenges. And I think it is really now is the time to revisit. How do we deal with cross-border health? It's not working. We know it's not working. So it works for emergencies. It works quite well. For anything else, it's a disaster if you've ever tried it. And I think now it's also the realization it makes a difference, because I think before lots of these issues were theoretical or they didn't affect many people, that it seemed abstract and didn't seem to concern us. Today we see it very much concerns us. It concerns us in front of our door. We see how it affects our societies. So that's one thing. I think something that's interesting in this concept is the role of civil societies. And, you know, there's a lot of blah, blah, how great they are, what they do. But if you really see what they're moving on the ground, it's absolutely impressive. And of course, digital helps in that. People today are very much are organized to a different degree. It's easier to organize yourself than the generations before. So I think that is also something for us. We talk about, I mean, also now on the cancer mission, it's all about citizens' involvement. Well, this is citizens involved. Just look, you just have to watch what is happening on the ground. People don't have to be told that others need shelter and food. So I think it's also for us a time to rethink our societies, rethink the role that citizens actively play. And you can't just say on one side, we let citizens sort out the mess, but we don't give them a say in what is happening, because that will not fly. So I think it's kind of, it's a time of change, it's a time of movement. And actually, I'm always looking for that silver lining and the glass half full, because, solving abstract problems is really hard, because you don't really know whether you're going the right way. Now we have concrete situation that we have to solve. I think we should use the learning opportunity and really think and have an honest discussion about it, because this finger pointing has to stop. We've had it in the past that, this country is at fault and this country is at fault, and we all are at fault at times. If you think about Eastern Europe has been educating medics and HCPs for the West for many, many years. There has been a brain drain from these countries. That's not okay. We see now the result of that brain drain. We cannot cope with these, just like if the people who were educated there had stayed there, the situation would be different. So it's time to kind of bring this up. And I think, just like it's already moving. We have made more progress in the last month on certain topics than we have done in the years before. So
I would like to say we're getting a lot of comments here, more than questions, and a lot of people sort of it's sort of turning into a therapy session in many ways, which is great. I mean, obviously a lot of us are frustrated with what's going on. Natasha Balanos, who's obviously very involved with autologous and stem cell transplants, she's discussing the fact that there's a need to deal with cell tissues, and many of the organizations are just joining up and cooperating among themselves, and she agrees also with everything you said. There's another comment here that whatever we do, we need to decrease the level of bureaucracy, because those on the ground are not being necessarily listened to, and couldn't agree with that more as well. And that gets to your point, Bettina. The last thing we want to do is load up a bunch of more paperwork and bureaucrats in Brussels that aren't going to actually get things done necessarily in the member states. We need to find concrete solutions here, and using the cross-border care in a way that actually delivers results. On that point, we're almost out of another hour. But what are the most urgent needs now? And we just got a couple minutes, so if I could restrict you folks just to 1 minute each. What are the urgent needs now? And if you had 2 deliverables you could make right now, what would you want to do? I'll start with you, Marius. What are 2 concrete solutions, and you've just got a minute, 2 concrete solutions you deliver now, if you could?
One is to somehow to cut it temporary and to make it somehow permanent. Mechanism protection for the migrants, in order to provide them more, stability and more data and so on, including healthcare. So I think this is, and for this, as Bettina said, we need the cooperation of the European institution and as well the member states. And I think the neighboring countries should be in front of this, because they are affected somehow by this the war and the crisis. And the second is to use this framework of inequalities designed by the European Commission, actually, in relation with cancer, and to act in this frame, having in mind what Bettina said, the role of the civil society. We should not reinvent the wheel, because we have a lot of evidence on the role of civil society. We need maybe another half an hour to explain our role in this, but I will not enter into more details. But yes, this is actually a very important moment. It's a crucial moment. It's something that I think we somehow needed in order to understand better the challenges that came from the Eastern countries in this East-West obvious divide. And I will add just one number: around 7% of the budget of the National Health Insurance House every year go to Western hospitals. So it's not a brain drain, it's about money drain from health systems that are currently anyway, not so well developed and need for rethink.
Thank you, Marius. Bettina, final word is yours.
Okay, so that's a very, very difficult question. So the two most important things, and I've been worrying about that since the crisis started, because I always look for what's the most important thing to do. And
the quick win as it is, yeah.
Yeah, so the thing in there is, in a crisis like this, I think the point is to keep asking that question and address the most urgent single time and go along and learn as you go along. So there's never a single, I think the point to understand is there is not a single biggest problem. There are many multiple problems, they're interconnected, and you have to keep moving on all of them to not kind of let this break down. So I think it's a constant, like having a big picture view, overview, looking at the issue and keep ticking the things that have to move and keep going at it and keep being at it. I think that the solutions have to be tailored to the ground. They're very individualized. So you have to be able to kind of do the big picture while having the kind of fine-tuned setting on the ground. And I think that is the issue, because it looks so messy. It is so kind of complex, but it is to kind of get that mindset right that I believe will allow us to really solve this. So keep this agility on the ground, but address the issues that we have to solve at high level, at the level where they have to be addressed, and to have this, keep the connection between what's going on the ground to be able to address them up there. So I think that is, for me, the one thing that I believe we need to get better at to keep, to minimize the impact of this disaster, because we will always pay a price for it, but to at least minimize it. Thank you.
Thank you, Bettina. Thank you, Marius. It's always a pleasure to speak to you too. I wish the circumstances were better. But again, it was a very enjoyable conversation. Thank you for our audience for the time. Thank you for Mark Sharpendam for the sponsorship of the series. And with that, our morning is over. We can all go have breakfast, and have a good day, everyone. Thank you very much for your time. Bye-bye.